For our United Way Spotlight of the Week, we're going to be talking about an exciting new project that brings health care to underserviced areas. And I'm joined by Meghan O'Leary and Ryan Rolfe. Thanks so much for joining us today. So tell me about PORCH. Tell me what that is.
So PORCH stands for Portable Outreach Care Hub, and it's a large RV which we are using as an outreach vehicle to bring services to marginalized people in the community.
And how do you determine who's marginalized, Ryan? Are they the people that, I see already living in tents, or does it go beyond that?
It goes well beyond that. So, we do service homelessness. As we know, that is a very marginalized community. We also work very closely with people who use substances, mental health, and just, average citizens who, for some reason, don't feel they can go to their health clinic, or they want further testing, and we're able to provide that and provide referrals and connections to other services within our community here.
So it isn't just the United Way, it goes beyond that. There's a lot of different agencies involved in this project. Can you tell me about that, Meghan?
Yes, well, the initial idea came about as many partner organizations thinking through our outreach strategy and how we can have a more collaborative outreach approach to the community. And many people and many partner organizations felt that an outreach vehicle would really facilitate that. And so we had many meetings in terms of what this outreach vehicle could look like. So it definitely was an idea brought together by partners working together on improving our outreach strategy. We were lucky to have United Way provide some funding to allow us to purchase the RV, but really it's the idea that's come to fruition from input from many partner organizations who serve marginalized populations in Kingston and throughout the region.
So do you go, well tell me about it. You work on this vehicle.
Yeah.
Tell me about it. What's it look like?
So we have a 38-foot RV. It's quite massive. We have a group space as soon as you kind of walk in that we'll be able to provide education and just kind of group support for clients that are in need. Then we have a clinic space in the back that is more for Hep C testing, HIV testing. We do have a functioning bathroom which allows us to do STI testing as well. We have started doing RAM, so that's rapid access to addiction medicine on the bus as well, and that's been a huge uptake from our clients. We've been really listening to what the clients want, and that's one thing that they've been really voicing that they would like to see out on there, just to enlarge access to that program. So far to date, we've serviced 46 unique individuals.
Wow.
Many of these individuals, they don't have any family doctor, they don't have any health care anywhere. So it's very vital for them to be seen and to build that relationship, right? A lot of clients, they don't trust very easily, so the work is very difficult, and it can take time and it can be slow because we got to build those relationships, we got to build that trust. But once it's built, it's really a beautiful thing to see some of these people that had these walls up and these guards up so thick and so heavy, to see who they are.
So the people who staff this, are they MDs? Are they nurses? Like who are the people that assess what's going on with these folks?
So as of right now, it is out 2 days a week right now. We are looking to increase that in the future, but Mondays and Wednesdays we have an outreach worker, usually a nurse on it, and a counselor. We're looking to add to that as well. We're always looking to build with community partners just to provide a more well-rounded service to our clients. So,
okay.
And then once a month as well, we have psychiatry offered on the RV. So, getting some of our marginalized, vulnerable patients down into a clinic space for psychiatry can be difficult. So having this service and being able to bring that to them, it's just removing that barrier, right? There's so many barriers for marginalized, vulnerable folks in the community. So
Meghan, this vehicle moves around, travels around. Where? It's a pretty big vehicle. It's not like you pull it into a driveway. What do you do? How do you do this?
No, and the idea was to take it to places where there's not already the physical infrastructure. So although we're looking at partner organizations providing service there, the idea was to go to places where there's not already an exam room or a clinic space or group setting to use. So we had initially started up with testing some sites in Kingston to see what the uptake was like and kind of learn and grow from there. So we are visiting places like the tiny homes where there's some people who are being housed in individual settings, and so bringing support services to them. As well as around Bell Park off Montreal Street. Also the Integrated Care Hub, which we know many people live and access services and supports there, but there's not a good clinical or private space for counseling and care. So the RV is there twice a week. And also through supportive housing, we provide some services there as well. And through a motel that is offering some stabilization beds in the West End. So providing some housing, and this is a good opportunity for us to bring some wraparound services and supports to folks who are accessing stabilization beds. So the idea is to bring the services and supports to folks who need it. And as we've kind of tested these sites and seen what uptake is like, we're then looking to expand further afield and move outside of Kingston to smaller towns as well who don't have large spaces where we can provide service.
And I could see where then you've got the physical traveling, trying to get to medical services isn't just any other kind of barrier, but that on top of it, the most practical barrier. You said you have 46 people. What is the most common thing that gets them through the door?
Just kind of engagement, and it's the lack of stigma and judgment when it's coming to marginalized, vulnerable people. We all know homelessness, substance use, mental health, they're very highly discriminated folks in our community.
So does this mean that, like, we have, well, we call it free medical care. It's not free, we pay for it through our taxes, but socialized medicine. So why don't they just go to a clinic or go someplace else? What happens there? I don't understand.
Well, and that's it. So a lot of clients have reported back that the way they're treated, they get labeled as drug seeking. They just don't get the same kind of opportunities as what we provide, I guess. So they really enjoy engaging with us. You know, we do value lived experience. We do hire with lived experience as well. So you know, a lot of our team members have been there. Myself, I'm a recovering addict, so I've been homeless. I am in recovery myself. So being able to engage and connect with clients who are still unwell goes a long way. And the clients can tell too. They can really appreciate and kind of connect with somebody who has a little more lived experience.
Yeah, I could see that. Wow, good, and good for you for
you.
doing what you do,
Yeah.
and overcoming what you have overcome. Good for
Yeah.
you. Yeah. Meghan, in the short time we have left, what is it you really want people to know about this project? Because I can see people saying, "Oh, come on, you know, well, like, what's the need for this?" But tell us about that.
Well, the success of this program hinges on partners coming together to deliver services through this mobile site. And it really is about bringing services to folks who need it, to provide some community-based health interventions, making it an access point for care and support, and really using that as an initial engagement tool, engagement option to engage people in further health supports as well.
Wow, it's a wonderful project, and good for the United Way for supporting this, and good for the other agencies, and for anyone who wants to know more, there's contact information on our screen. Thanks so much for coming in today.
Thank you for having us.